Okay, so in this video, we're gonna work on hip extension. And I have Kay laying in the Norwegian position, which is like a half prone position, which is a really great position to work on a lot of the things that we've talked about, especially extension and then the rotational or transverse plane movements in prior videos. But for this video, having the foot on the ground allows the opposite hip to be flexed, which just protects the lumbar spine. As we then go to take her opposite knee into flex position, the client needs at least the ability to get to that 90 degrees of knee flexion here. If they can't do that, then you really need to work on quad length first. So the way to do that, we do have some good stuff here, but she does get to 90 degrees of flexion. So what I feel is down here closer to the knee. As I go to flex her up, it's really not until I get to about here that she goes, oh. So it's not a positive squinch test, that's a positive test. All right, try to straighten your knee out, okay, right there. So she's engaging into my fingers. So I am working on getting the quad to let go and let it go. And I'm just kind of feeling what makes that quad feel even tighter as I engage with my fingers and push away there. Good, and let it go. Okay, so let's say that you've worked through that and you've gotten to the ability for your client to get to that 90 degrees of knee flexion. The next thing I'll do to work on, actually work on hip extension, is I'll bring my hand underneath the knee. I'm using my shoulder to try and keep her hip in a neutral position there. I'm going to bring the hypothenar eminence of my mobilization hand. I don't want to be on her sacrum. I don't want to be on her pelvis. I want to be on that posterior hip because we want to work on hip extension. So theoretically, having the left foot forward is helping to block that pelvis from moving too much. So I don't need really an extra hand for that. So I'm going to sink into that posterior hip capsule. And then from here, I'm not going to lift with my arm. I'm going to stand up out of my feet there to engage that barrier. Now I can have her press her knee down into the table. And I'm blocking it from coming posteriorly with my left hand or my treatment hand and let it go right there. And I see, try to relax your leg, Kay. Good. There you go. Relax that glute. There you go. There. Whoa, there you go. That worked. And then I'm going to try to stand up taller. So now I feel a nice stretch on the front. Pull down with your knee. Good. And let it go. And we'll say that we're into the end of our mobilization. Then I'll have her try to press her foot and heel straight up towards the ceiling. There we go. And now hold that up there. Hold that up there. And I try not to let her to go into too much external rotation. So take that heel out. Hold it up. Hold it up. Hold it up. Don't let me push your foot in. Woo, so that's more, I'm more interested in the rotatory component with the extension for her and relax. Well, not most people, that's probably true for a lot of people, but really you want to get that glute max. So ultimately hold there, okay? Don't let me push you down. I would be providing that re-education resistance there into that glute and relax down. So that is working the hip into extension in the semi-prone or Norwegian position. Work through the quad first, and then you'll be able to work directly into mobilizing the hip anterior as you work into extension.